Hello, my name is Kim Davies. I am a fourth-year PhD candidate in the Comparative and Molecular Biosciences graduate program at the University of Minnesota. Today I'm going to tell you about my thesis project on utilizing a mouse model to find ways to minimize the detrimental effects of cancer-related cognitive impairment. Cancer-related cognitive impairment, or from now on what I will refer to as CRCI, is a syndrome that affects cancer survivors. CRCI causes symptoms in cancer patients that disrupt their quality of life for up to 10 years following cancer therapy. The symptoms cancer survivors have reported are memory loss, learning deficits, difficulty processing new information, alterations in attention, and inability to plan and perform multiple tasks. CRCI decreases the quality of life in cancer patients through decreasing their independence and negatively impacts the survivor's social, family, and work life. Chemotherapy and radiation therapy are both shown to cause CRCI. These therapies are incredibly valuable for cancer patients, and yet they have side effects, like most other medications and treatments. We want to find a way to reduce or even prevent these side effects. CRCI occurs following treatment for many solid tumors, including prostate, testicular, ovarian, intestinal, and breast cancers. As of 2022, there are approximately 18.1 million cancer survivors in the United States. It is estimated that 75% of these cancer survivors suffer from CRCI, which is equivalent to 3 times the population of Minnesota. What we know about CRCI is from research on cancer survivor populations and from rodents treated with cancer therapy. Chemotherapy and radiation therapy cause the production of inflammatory molecules that can travel via the bloodstream of cancer patients. Both therapies can lead to inflammation and detrimental changes in the brain. Chemotherapy and radiation therapy cause cognitive impairment in cancer survivors. We know cancer therapy can create inflammatory molecules, but what we don't know is which inflammatory molecules are responsible for the inflammation of the brain that causes CRCI. In our research, we utilize animal models to learn more about CRCI and to determine the inflammatory molecules responsible for the inflammation in the brain and cognitive impairment affecting cancer survivors. One of the animal models we utilize is a mouse model. The mice in our model don't have tumors, ruling out any changes caused by a tumor. The mice are treated with chemotherapy, radiation therapy, or both. The mice then go through multiple mouse behavior tests to evaluate learning and memory. The behavior test shown here is the Y maze, which evaluates spatial memory. Then we evaluate inflammatory molecules produced in the bloodstream of the mice after cancer treatment. We also evaluate any changes found in their brain, including brain inflammation. We do this by assessing the local immune cells of the brain, called the microglia. Microglia activation can lead to brain inflammation and cognitive impairment. We plan to use this information from our mouse model to help identify strategies to minimize brain damage in cancer survivors by blocking the molecules potentially causing the problem. In doing so, we hope this will improve cancer survivors' quality of life for years to come. I would like to thank the funding support for this research and researchers who have assisted with this project. Thank you all for listening.